Recognize and reduce your blood clot risk. Oftentimes, when someone is diagnosed with a blood clot in their arm or leg, also known as deep vein thrombosis or DVT, or a blood clot in their lung, also known as pulmonary embolism or PE, they want to know why it happened. In this video, we will discuss the factors that can increase a person's risk for developing blood clots. A blood clot can form in your body's deep veins for several reasons. Some of the most common risk factors for blood clots include hospitalization or surgery, injury to a vein from trauma, such as a broken bone, a family history of blood clots, cancer and some cancer treatments, pregnancy, including the 6 weeks after the baby is born, use of birth control methods that contain estrogen, such as the pill, patch, and ring, and the use of hormone therapy to treat menopause symptoms, obesity, confinement to bed or sitting too long, especially with legs crossed. Blood vessels can be injured in numerous ways. Any trauma to the body, for example, from a leg fracture or major surgery like knee replacement, can cause damage to a vein and increase the risk of a DVT. Following an injury, surgery, or acute illness, you should be mindful of any signs or symptoms of blood clots. Some people are born with hereditary risks, including protein deficiencies and gene mutations linked to blood clots. It's important to investigate family risks to ensure that they are part of your formal medical record. Cancer is a disease highly associated with DVT. Patients with cancer are at heightened DVT risk for several possible reasons. First, cancer invades surrounding tissue and may damage blood vessels. Experts also believe that cancer cells may trigger inflammation that activates the blood clotting process. Also, various chemotherapies are likewise associated with the occurrence of blood clots. If you are currently being treated for cancer, be sure to discuss your potential blood clot risks with your doctor. Women who are pregnant are at an increased risk of DVT, especially those who are obese, smoke, have diabetes, or suffer from varicose veins. Even after childbirth, new mothers are at heightened risk for up to 6 weeks after delivery. Women who use estrogen-based birth control, including the pill, patch, and ring, also need to be aware of potential blood clots, particularly if they have a family history of blood clots, they smoke, or they are 35 or over. Inactivity can limit blood flow and make you more prone to blood clots. This is particularly true if you sit for long periods of time. For example, if you travel often on airplanes or long car rides for 4 hours or more. Patients recovering from surgery or patients who are bedbound for days or weeks are also at higher risk. Although some risk factors can't be changed, there are several things you can do to lower your blood clot risks. For example, stop smoking. Smoking cigarettes affects many more organs than just your heart and lungs. It also damages the lining of your blood vessels and contributes to circulation problems. If you use an estrogen-based contraceptive, it is particularly important to stop smoking because smoking increases significantly the blood clot risks of estrogen-based birth control pills. Lose weight. Being overweight is another risk factor for DVTs. If you are overweight, talk to your primary care provider about various weight loss strategies, including an exercise program. Be active when traveling. Sitting for prolonged periods of greater than 4 hours increases the risk of developing a DVT. During long trips, periodically walk up and down the aisles of a train or airplane. Stand and stretch occasionally on a bus. If traveling by car, take a break from driving every hour and walk around at a rest stop. Speak with your doctor. Be sure to tell your doctor if you have risk factors for blood clots. If you are hospitalized or require surgery, ask your doctor what can be done to improve your blood flow and lower blood clot risks.